Okay, just want to preface this evaluation by saying that I'm missing a couple tools. I don't have my goniometer, my reflex hammer, or my BP cuff, so I would obviously usually be doing those things as well as my gait belt. So I'll just be simulating those. Hi Nora, how you doing?
Hi, I'm good, thank you.
Good. My name's Haris. I'm going to be your student physical therapist today. I'm under the direction of Dr. Wright, and we're going to be chatting a little bit and checking out your knees and seeing what's kind of going on with that. Does that all sound okay?
Yeah.
Awesome.
Yeah, sounds good.
And when we do get started, I'll just be having to kind of place my hands around your knee area and your hands. I'll be taking some vital signs. Is that all okay?
Yes.
Great.
That's
okay.
fine.
So let's start by just chatting a little bit. You've had a couple home health sessions. Can you tell me about how those have gone?
Yeah, so I've had, I think, 4 of them over the past 2 weeks or so.
Okay.
Ever since I had, the surgery in my right knee again. And so with that, we've just been trying to but we've just been trying to get my leg to be straight and bent, because those are the 2 positions in which I tend to feel pain.
Okay.
And so I've been doing those exercises also.
And how's that all been going for you? Have you been tolerating it well?
Yeah, it's been going okay. I do still feel the pain though. So.
Okay. Can you tell me more about your pain?
Yeah, so really I just feel it a lot in my knees.
Okay. Both sides?
Both sides, yeah. I would say at this point, probably a little bit more in my right knee.
Okay.
That's probably just because of the recent work that I had done there.
Right.
But yeah, it is in both of them.
Okay. And I was looking at the intake forms. It's really just been kind of around the incision site, right?
Yeah.
Okay, so the front and the side of the knee?
Yes.
Okay, gotcha. And then you would say it's the same thing for the left side too?
Right.
Similar?
Mm-hmm.
Okay. So what sort of things make your pain worse?
Yeah, so I find that the pain gets worse if I need to walk a lot, or if I need to get my leg to be straight, or if I need to bend it a lot as well.
Okay. And how about steps?
Steps are also tough. I can't do those on my own.
Right.
And I have steps in front of my house as well, and so that can be a little bit difficult because, I do need help to get up on steps.
Sure.
Or even a curb as well.
Okay. And then can you tell me more about your home situation? How many steps do you have? Are you living at home with anyone?
Yeah, so I am at home with my husband. And in terms of the steps outside of our porch and front door, we have a total of about 5 steps.
Okay.
They're just very big, wide ones.
Gotcha.
And so I can fit my walker on those steps.
Okay, gotcha. And so you've been walking with a 4-wheeled walker, is that correct?
It is a 4-wheeled walker.
Okay.
Yes.
And you're using it most of the time?
Yeah. About I would say I use it about 75% of the time.
Okay, gotcha. And I did look at your intake form and saw that you're trying to get rid of that guy pretty soon.
Yes.
Yeah. I'm sure it's a little frustrating.
Mm-hmm.
Yeah, no, we'll definitely work towards that. And is your husband's able to help you out if you need it around the house?
Yes.
Okay,
Yes.
great. That's very good.
Mm-hmm.
So I saw that you are a writer of romance novels.
Yes.
That's awesome. You've been doing that for a while?
Yeah, I have. I've been doing it for about 30 years now, I'd say.
Very cool.
Thank you. Yeah, it's quite fun.
Yeah, that's sweet. Do you have any problems, when you're sitting at your desk or writing out anything right now?
When I do sit down, I feel a bit of pain in my back and neck.
Okay.
A bit.
Okay.
Nothing too crazy. But I do feel that.
Okay, and how long has that been going on for?
Oh, I feel that's been going on and off for quite some time at this point.
Okay.
And again, like I said, it's not been too bad. After I had the recent work in my right knee done, I feel that has made my back pain a little bit worse.
Okay.
So.
All right.
Yeah.
Well, we can work on that too. Oftentimes that could just be because you're at your desk a lot and you might just be in a slouched posture.
Right.
So I'll give you a couple things to work on that as well too.
Okay, great.
Great. So, and then you said you've been having some sleep issues as well. Can you tell me more about that?
Yeah, so my sleep issues seem to mostly be connected again to the pain that I feel, mostly in my knees, also like a little bit in my back as well.
Okay.
And so that tends to make it really tough for me to go to sleep.
Okay. But after you wake up, are you able to fall back asleep eventually?
Eventually, yeah.
Okay, that's good. And what position have you been sleeping in?
I sleep on my back.
On
mostly.
your back? Okay, gotcha. Let's see, and then your medical history, you mentioned that you've been having some migraines.
Yes.
And that's difficult for sure. But with that, do you have any association with like loss of balance or anything like that?
No.
Okay. Any
Nothing
dizziness?
Like that. No.
Okay. Any loss in vision or changes in vision?
No.
Good. And then any nausea?
Nope.
Okay. Good. And no loss of consciousness or anything like that recently?
No.
Great. Very good. And have you had any history of falls?
No.
Good. Very good. Okay. And I did see that you're taking some medication for hypothyroidism. Is that correct?
Yes.
Okay.
Yes,
Okay.
I am.
Okay, great. And so, any problems with the medications that you're taking at all?
So far, no.
No? Okay, and you're taking all of them currently?
Yes.
Okay.
Yeah.
Gotcha. So you also mentioned that you used to walk around the neighborhood. How long would you usually go on walks for?
Probably for about 20 or 30 minutes.
30 minutes? Okay. Do you do anything else for fun? That
I
you're not
play
able
golf
to?
a bit, yeah.
Okay, gotcha. Yeah, the weather's getting nicer. It's time to get you back so we can go do that too.
Right.
So then I asked you about what makes your pain worse. What makes it better?
Typically, I find that what makes it better is if I've got a pillow,
Okay.
and if I can keep my knees like at a bit of a bend.
Bit of a bend.
Mm-hmm.
Okay. Great. Let's see. And I did take a look at some of your goals that you're trying to get to. So you want to shed that walker in a couple weeks. You want to be able to straighten and bend the knee without any pain.
Yes.
Were there any other goals that I'm missing there?
No, those are really my two goals at this point.
Okay, gotcha. Let's see, I think that should be all good right there. Okay. And then one final thing, just about your home health sessions. Is there anything during those that, like you wanted to talk to me about, like that went really well or that didn't go too well, or was it all just pretty standard? Do you feel like you're kind of improving a little bit?
I would say it's pretty standard, yeah.
Okay, gotcha. You said that they were just kind of stretching and straightening the leg. Right?
Mm-hmm.
Okay, great. That's all good for the questions. Go ahead and put that laptop there.
All right.
Okay. So I'm going to start by just taking some vital signs. Okay? So we want to just get a good baseline measure of where you're at, just make sure that there's nothing going on or any problems. So I'm just going to start by taking your heart rate, so you can go ahead and bring your hand out. And your pulse there. Great. Okay, so 65. That's absolutely normal. It's really great. And then just go ahead and take some breaths for me, just normal as you would. I'm just going to be observing. I might just keep my hand really close here just to feel for that. Okay. Is that all right?
Yeah.
Okay, go ahead. Perfect. So we got 16 breaths there. Again, that's perfectly normal. This is where I would take the blood pressure as well. So we got those measurements at rest. I'd also be doing that when you're exercising and then after you exercise as well, just to make sure that you're safe. Okay.
Okay.
For now, we're good. Okay. Next, I'll just be kind of taking a look at your posture here, just how you're sitting.
Okay.
So, you mentioned that you've been having some of that neck pain. So do you feel like you kind of slouch when you're sitting at your desk sometimes?
Maybe a little bit, yeah.
Okay.
Yeah.
Okay. Let's take a look at that. Okay. And I know you're here for the knee, but I also want to, help you out if I can with the neck and back too.
Sure, yeah, I appreciate that.
That's good. Okay. Good. Yeah. So when you're sitting at the desk, just real quick, I can just kind of tell you about that. It's really nice to just kind of do this little double chin position, and no one looks good doing this, I promise you. But just think about doing that as you're sitting at your desk.
Right.
And then just trying to sit nice and tall. You don't want to slouch like this. That ends up putting a lot of pressure on your back. Especially when you're sitting there for hours and hours and hours, okay?
Right.
Another thing is helpful, like you don't want your arms to be too high on the desk when you're typing. So just try to lower that desk down or lower your or raise your chair height up if you can.
Okay.
So that's all just going to take a little bit more pressure away from those structures. All right.
Okay, great.
But back to the knee. So I'm just going to be feeling around here, just starting with the left side.
Sure.
Okay. And the joint line. Any tenderness or pain there?
Yeah, I do feel the pain there.
Okay, gotcha. And is that kind of like a sharp pain?
Yeah, I'd
Deep
say it's
pain?
more of a sharp pain.
Okay, and it's just tender to the touch? Okay, start this side.
Yeah, definitely feels
Definitely there? Okay,
tender,
well, I'll let that go. And do you feel the same type of pain on this side too?
It is the same type of pain, yes.
Okay, gotcha. Let's just kind of, if I can, I'm also just going to kind of look at the hip too, if that's all right.
Okay.
So just kind of feel around here. Okay. Does that feel okay? Any tenderness or anything?
It just feels a bit weak and I would say a bit tender.
A little tender, okay.
Mm-hmm.
And then on the right side?
Yeah, it feels about the same.
About the same there?
Yeah.
Okay, great. Let's have you stand up if that's all right. I got your walker right here.
Sure.
Okay. Good. And we got a gait belt around you. Let's put this side up. Okay. All right. So let's check in back here. All right. Looking at the levels, a couple prominent bony structures here. Seems fine. Good. Is your back tender to the touch or anything?
No, I wouldn't say it's tender.
Okay, good. All right. And then just looking at how you're standing with your feet. Okay. That looks fine. Okay. And if you don't mind, do you mind taking a couple steps for me?
Sure, yeah,
Okay.
I can try.
Great. All right, go ahead. I got you.
All right.
Okay. And turn around if you can. Good. Great. Okay, have a seat.
All right.
So I definitely noticed that you're kind of swaying there.
Yeah.
Can you tell me a little bit more about that? Is that because of the knee pain, or is there something else?
That's what I think it is. I do think it is because of the knee pain.
Okay, gotcha.
Mm-hmm.
Do you feel like when you're doing that, like you're not able to put any weight like on your hips or anything like that?
It does feel like I can't just like put any pressure on that leg in general, I'd say.
Okay.
It's hard for me to try and keep that weight there.
Okay, gotcha. Well, we'll look at some of your strength too. I'm suspecting that there might, be some deficits, not just in the knee, but maybe higher up too. So we'll look at all those things too. Okay.
Okay. Yeah.
All right. Okay. Next, I'm just gonna do a quick screen here. So with this, we're just making sure that your light touch sensation is doing all right. Okay, so there's no problems with your nervous system or anything. So with this, I'm going to ask you to compare what it feels like when I touch your face right here.
Okay.
So that feeling. And then I'm just going to be touching both sides, and I want you to compare if it feels the same from right to left. Okay?
Okay.
All right. So, how's that?
It feels the same.
Okay. And there?
It feels about the same, a little more tender on my right.
On the right side. Okay.
Yeah.
Right there?
Same.
Good. Right there?
Same.
And right there.
Same.
Good. Okay. And then I'm going to have you try to bring that left hip up like this.
Okay.
Okay. And then I'm just going to be holding right here. Just try to hold your position, okay?
Okay.
Okay. And then this side. Is it tough to bring that up?
Yeah.
Painful?
Yeah. It's a little bit painful.
Okay,
yeah.
then we don't need to test that. That's fine. Okay. And then if you can bend your leg back, or sorry, straighten your leg out like this. And if it's too painful, that's all right. And we'll start with this side.
Okay.
Okay. I'm just going to be giving you a little bit of hold right here.
Okay.
Okay. And then this side. Is that kind of painful?
A little bit painful.
Okay, then we don't need to test that. All right. And then if you can flex your foot up like so.
Sure.
Okay. If I push there, is that okay?
Mm-hmm.
Good, that's strong. Awesome. We'll do this side. Good, that's pretty strong too. Nice. And then you're going to lift your great toe up right there next.
Okay.
Just the toe if you can. And then I'm just going to be pushing on that, alright?
Mm-hmm.
Nice, good. And then this side. Okay, good. And then finally, we're just going to flex that foot down like that.
Okay.
Just going to be pushing. Good. And then this side. Good. Okay. And then moving on, let's see how you're moving a little bit. So,
Okay.
I know I asked you to go through some of these motions again. If it's too painful, don't worry about it. But I want to see how much you can bend that leg back. So let's start with this side right here.
Yeah.
Okay.
Yeah, typically I find, not too far.
Not much more than that.
Mm-hmm.
Okay.
It's about my limit.
Got about 90 there. And then is that painful?
If I go past this, then yeah, it would be painful.
Okay. All right, you can relax. Let's try on this side.
Okay.
Okay, so about the same.
Yeah.
Okay. And then let's try to straighten this leg out as much as you can.
Okay.
Okay. About there. She's about between 5 to 10 away from neutral. Okay. And is that painful?
No, but it becomes painful if I try to keep that up.
Try to keep it. Okay.
Yeah.
Okay, and let's try it on this side too. Okay. So this one about 10 degrees from neutral. Is it painful right now?
Not now.
Not much. Okay. All right. Let's bring that back down. Good. Okay. Got a good sense of how you're moving, some of your strength there. Of course, at this point, I'd also test the knee jerk reflex. Okay. Now, can you show me how you've been getting up from a chair?
Yeah, sure.
Okay, so I'm going to be right here. Make sure you're safe. Go ahead.
Alright.
Good. And then stand right there for a little bit. You feel okay?
Mm-hmm.
Good. Okay. And then come right back down.
Alright.
Good. Do you feel like you're relying on one side more than the other with that, or?
Maybe a little more on my left side.
Okay.
But not like a huge difference.
Okay. Okay. That's good. I mean, that's obviously an activity that, you're going to be doing a lot. And
Right.
it does require a lot of strength coming from your legs.
Mm-hmm.
So, at this point, it's okay if that's a little difficult, but we're definitely going to be working on some things to help out with that too.
Great.
Okay. So let's get you in a standing position one more time.
Sure.
We'll work on a couple of things. So go ahead when you're ready.
Alright.
Okay. I'll just have you hang out there right now. I got you. So let's look at some of your balance next, okay?
Okay.
So when you're ready, I'm going to have you let go of that walker And I got you right here, okay?
Okay.
I'm just going to be giving you some support, and I'll be here just in case, and I'm just going to have you try to hold that position, okay?
Okay.
Your feet are apart. Good.
Mm-hmm.
Yep, that's perfect. How does that feel?
That feels okay. A little hard to keep up, but
Okay.
not too bad.
Okay. So we've been there for about 15 seconds. Let's try to put those feet together now if you can.
Okay.
Okay. Alright, and I got you here, and try to let go of that walker.
Alright.
How is that?
That feels a little more hard.
A little more challenging?
Yeah.
Okay. Alright, and then finally, if you can, and if you can't do this, it's totally fine. If you can put one foot in front of the other, starting with whichever one you'd like to start with.
Okay.
Okay, I got you here. Okay. Now, how does that feel?
A little tricky, but not too bad.
Okay. So you can see this is kind of simulating that walking position a bit.
Yeah.
So we're kind of seeing where you're at right now, so we can train it and know where to start from.
Right.
And let's try the other side. So left foot forward.
Okay.
I got you here. Good. Okay. Okay. And how's that?
Yeah, it feels about the same as the right side.
Okay. All right. Great. Let's have you walk over to this bed next.
All right.
Over here. All right. So we'll look at it just a little bit more of your muscles. So you can just let your feet dangle right there.
Mm-hmm.
Okay. I'm just gonna have you kind of straighten right there, and then try to push the leg back into my leg.
Okay.
Okay. Or into my hand. All right. So ready?
Mm-hmm.
Try to push, 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 push. Okay. And then we'll try this side.
Okay.
This around. Okay, the same thing, try to straighten that a little bit. And then push into my hand, okay?
Okay.
Push, 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 push. Okay. Alright. So that's pretty weak right there too.
Yeah.
Which is what we were expecting, so don't feel too bad about that. Okay. And next I'm gonna have you lay down on your left side.
Okay.
So we'll look at some of your hip strength here. Okay.
Mm-hmm.
Are you able to lift this leg up?
I can try.
Okay.
Oh yeah, no, I really
It's
can't.
kind of tough.
Yeah.
Okay, that's all right. Let's have you lay on your back then, if you can.
Sure.
So, can you bring this leg just out to the side? I know it might be kind of tough. I'll lift it so you don't have the bed
Okay.
resisting you. Okay, so you're able to do that. That's good. Okay. And then let's see. Let's have you flip over onto your right side. I promise this is the last time I'll have you move in the bed.
Alright.
Okay. So we're gonna take this bottom leg. So I'll bring this leg out.
Okay.
We're gonna try to bring this bottom leg up, and if you can't, that's okay. But try to bring that up like that.
All
Hold
right.
it there. Is that kind of difficult?
It is a little difficult.
Okay.
Yeah.
All right. Then we'll just keep it right there. All right. Okay. Let's have you. You can just lay down if you're comfortable like that.
Sure.
Okay. You can lay down on your back. Be a little more comfortable for you.
Mm-hmm.
I'll give you the pillow to prop up your leg. I know that kind of helps you.
Thank you. Yeah, it does.
Awesome. Okay. Is that comfortable?
Yes.
Okay, so Nora, let's chat. So I think I have a good idea of kind of where you're at right now. Okay.
Mm-hmm.
Let's start by talking about how you're walking.
Yeah.
So obviously I think you've noticed it too. You're swaying a lot to both sides.
Yeah.
So with that, I think that, it's not just the knee pain that's causing that. You might have some hip weakness going on. And we actually did see that with the muscle tests. They're quite weak. So what we're going to do is work on those. I'm going to send you home with some exercises that will specifically focus on the hip. And I know you might be thinking, oh, but I'm here for the knee. But, everything is related. So this is just a whole chain of muscles going down, right? And it's all connected.
Okay.
So if something's weak here, it's going to affect how, your knee is moving and working. It might actually put more stress on your knee.
That
So,
does make sense. Yeah.
right. So with that, we'll definitely be sending you home with some exercise with that, and I'm going to be outlining a home exercise program in just a second
Okay.
for you. And then just I just wanted to go over your sleeping position and ways that you might be able to get some relief.
Mhm.
What we have you in right here is a perfect thing. So your knees are propped up. Is your knee
It
feeling
does
a little
feel
better?
pretty nice. Yeah.
Okay,
Yeah.
good.
It does feel better.
So if you're able to do that at home when you go to sleep, I think that's going to be great for you to just, go to sleep and stay asleep.
Yeah.
And I know, like, you definitely want to be able to get that relief. I mean, you're already going through so many other things, right?
Mhm.
So we'll definitely keep that in mind for sure. One thing I believe I did not ask you, and I'm sorry about this, was your medical history. So did you have surgeries before on your knees or anywhere else? Or anything else I need to know about?
Yeah, no, I've had a few actually. So, I would say it was about 13 years ago
Okay.
when I had a partial replacement done on my right knee.
Okay.
And that went well.
Good.
I did have this done again, like two weeks back, as you know.
Okay.
But that was just because like it wore out. It had been so long.
Right.
But so there was that one, and then that was fine because that went well. About half a year after I had this done, they did a partial on my left knee as well.
Okay.
But that one didn't go as well. I still had like a lot of pain and weakness, and so my surgeon thought it would be a good idea to actually do a total replacement on that knee.
Gotcha.
But that still didn't really fix the problem. And so, again, this is probably like about a decade ago, is when I went to a different surgeon, and we realized, or he found out that it was because the original surgeon had actually, unfortunately, clipped part of the nerve.
Oh no, okay.
Yeah, and so that was why, there was still like a lot of the pain and weakness left. And so the new surgeon, did that one again, and that did help improve things a little bit.
Okay.
And so...
Have you had that left leg followed up on? Do you know anything about that nerve and if it's, regrown?
I'm not sure. I don't believe I've followed up on it.
Okay. Well, I would just say with that, when you get the chance, just talk to your primary care provider about that.
Okay.
See if you can follow up on it.
Definitely.
Because I did notice there are some strength deficits on the left side as well. So obviously you do have a history of that going on. So that's good to know. I'm glad that I remember to ask that now. So just think about that moving forward. And given that, we're definitely going to focus on doing your exercises and things on both sides.
Okay.
Not just because, that one side has also gone through other things. I just believe it's very important to stay balanced. Sometimes when you're working on, when one side is affected so much, you tend to rely on the other, and that can put a lot of stress on it. So we want to strengthen the other side too.
Okay.
All right, so we got you in this position. Another thing I just wanted to talk about quickly is the hypothyroidism. So with that, you do have a sensitivity to cold. Is that correct?
Yes.
Okay, and I know you've been heating the knee. Is that correct too?
Yes.
And that's been helping?
Yes.
Okay, awesome. And I love that you're doing that. I think that's a great idea, especially before exercise. To kind of loosen up the structures, loosen up the tissues, get you ready to, all right, like, I'm ready to start moving. I feel kind of relaxed here, and that's a great strategy to use. So I have no problems with that at all. I recommend you doing that for maybe 10 to 15 minutes before exercise.
Okay, that's good to know that there's a beneficial time of when to do that.
Yes,
specifically.
Yes, for sure. I don't want you to be doing it much more than that, and you don't need to be doing it like 4 or 5 times a day. Maybe no more than twice a day.
Sure.
You could think about doing it before exercise and after exercise.
Okay.
So that's going to be good for you. Let's move into your home exercise program. How's that sound?
Yeah.
Let me take this for you right here. Okay, so I'm just going to be teaching you what to do, and we're going to be sending you home with an outline as well.
Okay.
So you don't need to remember everything I'm about to tell you, but I'll show you how to do everything, okay?
Okay.
Let's see. excuse me. So, what I did want to say, I think is really important. I love that your goals are getting back as soon as possible. You want to get back 2 to 3 weeks. That's awesome. I love
really
it.
love to.
I love having motivated people, working with them. So given that, this home exercise program is going to get you back to where you need to be. I fully believe in that.
Great.
And this is me giving you the exercises, but the other half is you doing them, right?
Right.
So we want to make sure that you're working towards them because at the end of the day, it's going to affect you, not me, right?
Right.
So I just want you to really know that and just kind of buy into that, okay?
Certainly.
All right. So I'm actually going to have you start. The first thing is what you've been doing in the home health sessions. We're going to work on straightening that leg out. Okay. So got this roll here. You can use a towel roll.
Mm-hmm.
And we're actually going to do both sides because why not, right? It's kind of a relaxing position here too. So we got you right there. And so you're really just going to be hanging out here.
Okay.
You can do this when you're laying down, watching TV. We're going to do it for about 5 minutes.
Okay.
And about twice a day.
All right.
Okay. And with this, you are kind of hanging out, but I want you to really just work on straightening the knee as much as you can from this position. Does that make sense?
Yeah, so it's not a completely passive. Like I want to think about trying.
You're resting, but I want
Okay.
you to make sure that you are resting in the most straight position that you can. Right.
Okay.
So you're not like pushing down or anything,
Gotcha.
but you're resting in the most straight position that you can tolerate.
Okay.
It's not necessarily going to be super comfortable, but that's okay.
Right.
Because we want to get that motion back, right?
It's part of the work, right?
Exactly. So we're going to do that for 5 minutes.
Okay.
Up here. Next thing, we're actually going to use this towel roll again.
Okay.
We're going to do something called quad sets. So this is going to help get your quad strength back, which is going to be important for walking, standing up from a chair, a lot of different things.
Right.
So, hope you get this knee up. And we're just going to do it one at a time with this one, but we will do both. And what you're going to do is just push down into that towel roll, and you're going to be using this muscle right here. So you're going to push down, hold for about 5 seconds. You feel that right there?
Yeah.
Good. And then you can relax. And then one more time, just so you really feel that. Good. So with that, we'll do anywhere from 30 to 40 sets, really as many as you can tolerate, as many as you can handle, because we really want to strengthen that. And we can do both sides again. Just do as many as you can. You don't need to do like 50 or 60, but as many, to the point where you feel like you're starting to get tired. Okay.
Okay.
And we'll do that a couple times a day. All right. That for you. Then next, I'm gonna send you home with this band here. That is right here, actually. So with this, I'm gonna have you bend your legs up.
I like this?
Yes, a little bit more if you can. I know it's a little tough for you. That's perfect.
Okay.
So we talked about the hip being a little weak, right?
Right.
So with this is gonna work on the sides of your hip, which are actually very important in when you're walking. And will hopefully reduce some of that sway.
Okay.
So you can have your husband tie this for you. Get him working a little bit too, right?
For once.
Yeah, there you go. So you're simply just going to tie it. Nice little bow, like you're doing shoelaces, right? Okay. And what you're going to be doing is just going out with the knees, like so.
Gotcha.
Okay. As far as you don't need to go much farther than like your hip width.
Yeah.
But you want to make sure that you feel that working. Do you feel that?
I do feel that. Yeah.
Good. Good. So let's try that a couple times.
All right.
Okay. And this one will again. I just want you to work until you feel like you're working pretty hard. Like I don't want you to just do like 10, 20 sets and it's super easy. And that's okay if you can't get to that.
Right.
Whatever you feel like is working you super hard. I would say maybe a good benchmark number. We could start with 10 to 15. Okay.
Yeah.
And just go from there. Okay. And do that a couple times a day.
That seems like a good amount.
Awesome. Does that feel okay?
Yeah. Yeah.
So we'll send you home with this guy.
All right. Thank you.
There are different levels of resistance. As you move forward, we'll give you those and help you get better with that.
Okay. Great.
we got two more things. I'm gonna have you flip over onto your stomach.
All right.
Okay. This next one will help you work on getting some of that knee bend back.
Okay.
So ideally we'd have a belt so we could loop the foot around, but we'll just use a strap for this purpose right here.
Okay.
So I'm going to give you the strap right here in your hand. Okay. And then try to bend that leg back for me if you can.
All right.
Good. Okay. No, that's about what you got there.
Yeah.
All right. So I'm going to hold on just to show right what we're doing, okay? You're going to be pulling with that left hand, pulling your leg as much as you can.
All right.
Okay. Right about there?
Yeah.
Okay. So in that position, I want you to hold for about 30 seconds.
Okay.
Okay. And again, you're not pushing into pain or anything. You're just going to the right to the moment before you start feeling that.
Right.
And this is just a pure stretch of your quad right now.
Okay.
Trying to get some of that motion back, okay? So we'll hold that for about 30 seconds, like I said, and we'll do it 3 times each.
Okay.
And again, you can do the other side as well, right?
Right.
So this is something you can, again, if you choose to watch TV on your stomach or if you're just kind of hanging out, this is something you can do a couple times a day too. Okay.
Yeah, it feels like a good stretch.
Great. Okay. And again, you don't want it to be painful or anything, okay?
Right.
All right. And then the last one, if you can sit up for me.
Mm-hmm.
I promise I'm done bugging you after that. So with this, we're just going to be doing some marches.
Okay.
So ideally you'd have your feet on the ground. Right now it's okay. I don't need you to, to get up and show me. But you'll have your feet on the ground and you're just going to be marching up and down for me.
All right.
Okay. And really make sure, so I see you're kind of leaning with that.
Yeah.
Try to keep your body nice and tall. And just focus on bringing those knees up. Nice. You see how that
Gotcha.
works you a little bit more?
Yeah,
Yeah,
it
there you
does.
go. Nice. Good. And so with that, we can do 20 times on each side, or until you feel like you're working super hard, and we can do that a couple times a day. Okay?
Okay.
All right, so you got your band.
Right, thank you.
We've gone through those exercises. I know it's 4 or 5 of them, so quite a bit, but we're going to print out an outline showing how to do them, when to do them, why to do them, all of the above, okay?
Thank you, yeah.
Yeah. So it's been awesome talking to you. Really looking forward to working with you.
Thank
as
you,
we
yeah,
go along.
same here.
And that's great, and seeing you progress. Do you have any questions for me before we end the session today?
No, I don't think that I do.
Okay, awesome.
Thank you so much.
Nice meeting you, Nora. I'll see you next time.
All right, take care.